Assalamu alaikum wa rahmatullahi wa barakatuh. Our article for this week is titled as Effect of the Time Interval of Functional Loading on the Periapical Healing of Endodontically Treated Mandibular Molar Tooth with Pulp Necrosis and Asymptomatic Apical Periodontitis. It's a split mouth randomized clinical trial done by Indian group and published in Journal of Endodontics in 2024. Several factors contributing to failure of endodontic treatment include extraradicular infection, the presence of true cyst, or foreign body reaction. Additionally, occlusal trauma has been identified as a significant cause of non-surgical endodontic treatment failure, with a strong correlation exists between periapical radiolucency in endodontically treated teeth and occlusal contact. This study aimed to evaluate the effect of immediate functional loading of full coverage prosthesis on the clinical and radiographic outcomes of non-surgical endodontic therapy in mandibular molar teeth with pulp necrosis and asymptomatic apical periodontitis. 20 subjects aged from 18 to 45 with bilateral mandibular first molar teeth diagnosed with pulp necrosis and asymptomatic apical periodontitis with BAI score larger than 3, and they excluded patient with parafunctional habits or with systemic disease that impairing healing, teeth with aggressive periodontal disease, teeth previously restored or cracked or immature, and teeth with a previous history of endodontic treatment and missing antagonist and adjacent natural dentition. Subject underwent non-surgical endodontic treatment in 2 visits, and teeth were randomized into immediate functional loading and functional loading after 6 months. A provisional full coverage prosthesis were provided within 7 days after endodontic therapy. Clinical and radiographic assessments were conducted at 6 and 12 months. Periapical healing was evaluated using BAI scores, dichotomized as healed if the score 2 or less than 2, or non-healed if it's 3 and more. Moving to the result, a recall rate of 100% was achieved at the end of the observation period, and all teeth in immediate functional loading group and functional loading group after 6 months were clinically asymptomatic. There was a significant difference in the proportion of healed teeth between groups, and immediate functional loading delayed periapical healing. In conclusion, based on this finding, immediate functional loading of full coverage prosthesis in endodontically treated mandibular molar teeth with pulp necrosis and asymptomatic apical periodontitis delays periapical healing compared to functional loading after a 6-month interval. Thank you.